Are you expecting a baby in Malaysia? Congratulations. But did you know that giving birth in a private hospital can cost anywhere between 8,000 ringgit up to 50,000 ringgit? And if your baby needs NICU care, bills can shoot past 100,000 ringgit. That's where a pregnancy medical card comes in. In this video, I'll break down what it covers, how much it costs, and which providers you should consider. Pregnancy is a joyful journey, but also a financial risk if complications arise. Prenatal checkups cost easily a total of maybe 5,000 ringgit. A normal delivery costs RM 8,000 up to 12,000 ringgit. A C-section delivery will cost around 15,000 ringgit up to 25,000 ringgit. And NICU stay can cost around 3 to 5,000 ringgit per day. Without proper insurance, families are left vulnerable. With the right medical card, these bills shrink to just a small fraction. What's covered? So, what does a pregnancy medical card usually include? A good medical card for pregnancy usually includes prenatal checkups and ultrasounds, normal and C section deliveries, pregnancy complications like preeclampsia and gestational diabetes, emergency hospitalization, and NICU care for newborns. These benefits give parents peace of mind knowing both mother and baby are well protected. Here are some of the leading plans in Malaysia. You have AIA and their A Plus Baby Care, Prudential's Pro My Child Plus, Allianz Baby Cover Plus, and Etiqa Precious Cover. Each comes with different strengths, so it's very important to compare them side by side before you decide. Now let's talk about costs. Basic maternity coverage costs around 1,500 ringgit up to 3,500 ringgit per year. Comprehensive mother and newborn plans will cost around 4,000 up to 8,000 ringgit per year. High coverage plans, which includes NICU and critical illness, cost around 8,000 ringgit up to 15,000 ringgit per year. Remember, hospital bills can easily exceed 100,000 ringgit nowadays, so these premiums can usually be well worth the money. These are the common complications that are covered by maternity health insurance: preeclampsia, gestational diabetes, premature labor, and ectopic pregnancy. So here's a real life example. A friend of mine did not buy coverage early enough, and the mother had an emergency C section, and the baby required more than a week in NICU. Their total bill cost over 60,000 ringgit. If they had a comprehensive pregnancy medical card, that amount would have been reduced to less than 10,000 ringgit, probably a few thousand ringgit. Two of the most common questions I get are: when should I buy maternity coverage? Some plans must be bought uh, during the early stage of the pregnancy, so it's very important to check with your insurance agent. Okay, question number two is: when can I buy a medical card for my baby? Okay, so most insurers will allow newborns to be enrolled in their medical coverage plan from 14 to 30 days after birth. with coverage for hospitalizations and sometimes more serious conditions. Thank you for watching this video. If you're expecting, don't wait until it's too late to get coverage. At Medica.my, we help parents compare the best pregnancy medical cards for their needs. We do not charge any consultation fee, there are no hidden fees, and we try our best to provide the best service. Click the link in the description or visit medica.my today to get started. Thank you so much for watching. I hope you have a nice day. Bye bye.